Another method of strength assessment focuses on evaluating the quality of functional movements, such as single or double leg squatting or performing a step-up. Functional assessment is often a very important role in the evaluation of the patient. Functional strength tests allow the examiner to assess strength within a natural context, and interest is in fundamental movement patterns essential for daily activities. For example, assessing the performance of the squat corresponds to sit-to-stand transfers, and step-ups aid in evaluating the ability to ascend and descend stairs or squats, and jumps evaluate the ability to perform similar actions during sport activities. Functional assessment may involve task analysis, observation of certain patient activities, or a detailed evaluation of the effect of the injury or disability on the patient's ability to function in everyday life and activities. The assessment also provides information on what is important for the patient and what are the patient's expectations. Functional testing provides a more comprehensive assessment than, for example, evaluating the range of motion of an individual joint. It yields valuable information about how an injury or disease affects the patient's daily life, which activities provoke symptoms, which activities are limited or prevented by the condition, and what physical requirements are necessary to perform those activities. Functional tests can be performed under different loading conditions. In some cases, repeating the test may be meaningful, and it may also be important to perform the test at a speed that reflects real-life demands. When assessing activities of daily living, functional testing may simply consist of evaluating the performance of the activity itself. For example, the time required to complete a task can provide information about functional ability and to obtain quantitative data. The ease of dressing may be assessed by measuring the time required to put on a shirt. The measured time can then be used to monitor changes in the patient's condition over time. Functional tests may also serve as provocative tests, meaning that they can reproduce symptoms reported by the patient or help determine whether the patient is ready to return to a specific activity. Functional tests are an effective way to gather information about lower extremity and pelvic control. In 2017, Lenzlinger-Asprien et al. Published a functional test battery for patients with hip osteoarthritis, and Kokkonen et al. Published a similar test battery for patients with knee osteoarthritis. These tests are relatively easy and practical to perform and include various squatting tasks, stair ascent and descent tasks. The assessment focuses both on task performance and movement quality, including the identification of movement control impairments. Picture presents step-up test that is visually evaluated frontally, and right and left sides are evaluated separately. Standardized instructions for this test are: first, stand behind the aerobic step facing forward, feet aligned about hip-width apart. Then, step up and down on the step starting with your right leg. Repeat the movement 4 times. Then, perform the movement starting with your left leg. Evaluation is made by using following criteria. A. Correct performance, 0 points. Movement is stable and easy. Alignment of the hip, knee and foot are good. There is no varus or valgus. There are no compensating movements. B. Incorrect performance, 1 point. Insecurity or helping with hands in the air. Pelvis does not stay horizontal. Alignment of the hip or knee or ankle or foot is not good. E.g., there is varus or valgus in the knee or hip is tilting in adduction or the foot is giving in. Failed performance, 2 points. The subject cannot perform the movement. Various jumping and landing tasks can provide valuable information regarding an athlete's readiness to return to sport following injury. One example is the landing error scoring system. The LESS test is a useful tool for identifying athletes with deficits in lower extremity movement control and a potentially increased risk of lower extremity injury. The test was specifically developed to identify individuals at increased risk of anterior cruciate ligament injury. This standardized jump landing task includes two segments. A. Participant jumps down from a 30 centimeters box and lands on ground. B. Participant immediately jumps vertically as high as possible. The performance is recorded from both the frontal and sagittal planes, and the recorded performances are scored. The scoring rubric includes 15 items rated as either 0 or 1 and 2 items rated as 0, 1, or 2. A total score of less than 5 is generally considered a good result and indicates a low risk of ACL injury.
Thank you for your attention. This video was produced as part of the Move On project and is co-funded by the EU.